So let's return to Perie. We've talked about the problem and the etiology portion of this cycle. So let's move on to recommendations. So once we understand the problem and we understand as best we can the etiology, the contributory causes, we then try to make recommendations. And we look to find out what would work best with a population. Sometimes something that will work with one population won't work with the best. So we need to make sure that things are appropriate. We need to make sure that if there's an existing intervention, that we look to see how it was implemented and what it entailed so that we're not creating something from scratch. There are websites that list different interventions for different problems, and we'll look at those with Healthy People 2020. So the implementation, once you've got your recommendation, we have to ask questions about implementation. So who should we target? When should we implement? And what type of program will work best? So with implementation, intervention has 3 different levels. We have primary intervention, we have secondary, and we have tertiary. Primary intervention is looking at individuals, or it's targeting individuals who do not have the disease. Usually it's through information and education in terms of how to reduce their risk and stay disease-free. Secondary is for individuals prior to their symptoms. So this would be people who are in an at-risk population, but they don't have symptoms yet. The third level, tertiary, this is for individuals who have the disease, but we want to see if we can't limit the damage the disease causes. Another way to look at the strategy of prevention in terms of primary, secondary, and tertiary is illustrated here. So with primary, you're looking at people who are susceptible to get the disease, but they don't have it yet. And the effect is we want to reduce the incidence of disease in this population. Secondary prevention is looking at individuals who might have the disease, the start of the disease, but they're asymptomatic, meaning they don't yet have symptoms. So we're trying to reduce the prevalence and the consequences. We're trying to keep the disease from fully developing, say in the case of cardiovascular disease. For tertiary prevention, these individuals, these populations are symptomatic, and again, we're trying to reduce the complications or disability. So keeping in mind that primary activities intend to prevent the onset of disease or injury, secondary is intended to minimize risk or complications, and tertiary is intended to minimize disability caused by the disease, let's go through some examples and see if we can figure out what level of prevention it is. Condoms. What level of prevention do you feel these are? Primary, secondary, or tertiary? How about a screening swab? This might be a swab culture, a throat culture being taken to see if somebody has strep or mononucleosis. What level of prevention would this be? How about a lab test? Let's say this is a lipid profile. My physician knows that I have a history of heart disease, a family history, and so my physician wants to keep track to find out what risk I'm at based on my blood lipid and cholesterol profile. Here's an HIV antiviral. It can treat an HIV infection and reduce the risk of HIV infection. It doesn't cure HIV or AIDS, but combinations of drugs that treat HIV infection may slow the disease progression and prolong life. What level of prevention is this? Primary, secondary, or tertiary? So bringing it all together, we start by looking at the problem, looking at the burden of disease and developing a hypothesis. Once we have our hypothesis, we try to find individual associations. We try to establish the cause preceding the effect, and that altering the cause alters the effect. Once we understand the etiology, we can make recommendations that address the mechanism of the disease, making sure that we keep in mind benefits, harms, and costs, and then we implement. We ask what level of intervention, what level of prevention do we need to best serve the population, asking the questions when, who, and how. And then we evaluate. That's the final E. Once you implement your plan, you then need to evaluate. This can be done through pre and post testing. It can be done by comparing incident rates, but it's a very important step because if there are things that need to be changed, it can be put back into the cycle and we can go through this again.